Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Dr. Elizabeth Salisbury Afshar, a physician practicing addiction medicine and working in public health on issues related to substance use disorders. Hi, Dr. Salisbury Afshar. How are you today?
Good. Thanks so much, Cindy. Thanks for having me here.
Good, absolutely. So tell me, why does stigma have such a negative influence on people battling substance use disorder when seeking treatment?
Yeah, I think it's a great question. And I actually want to just step back a little bit because I've been reflecting a lot on something that a colleague and friend of mine said at a conference last week. His name's Dr. Mishka Turplin. And he was asked a question on stigma. And he actually paused and said, he said, I don't like the word stigma. And I'm not going to be able to quote him exactly, but something to the effect of, the origins of the term stigma come from really like a mark or a branding on someone that is then a mark of disgrace. And so like mentioned the stigmata of Christ. Sometimes it was used in reference to people who had been enslaved, who would literally be branded as this sort of, again, mark of like belonging to someone or mark of shame, stigma. And he said, really, when we talk about stigma, especially in the healthcare space, the term that applies more is discrimination and prejudice. And I will say, I've been reflecting on this since I left, and it's something that I'm still continuing to think about. But I think especially when we talk about the impact of again, whether we use the word stigma or whether we use probably the more accurate term in this case, in this part of the conversation is discrimination. Um, Right, because most people with substance use disorders, we wouldn't know by looking at them. They're not carrying a physical sign or and so really it's about how they're being treated by others, which is a very active thing that we're doing to people. And so when we think about how this plays out in healthcare in particular, again, as an addiction treatment physician, I am constantly aware that most people I work with have been treated very poorly by healthcare systems and even by addiction treatment systems in the past. And it's not uncommon. I mean, I only have clinic once a week, and then I also work in the hospital. That I'll be working with someone in the clinic and say, I'm so sorry. Like, I really think you need to go to the ER today because you're having these things. And I can't manage it in our clinic. And people will be like, Doc, like, I don't want to go to the ER. Like, do you know the last time I was there, I didn't feel heard. I didn't feel respected. I didn't feel like they listened to my symptoms. And they just kept assuming everything I was experiencing was related to my substance use. And look, that's just not the case. Or even if it is related to your substance use, it doesn't mean that you shouldn't feel heard and your symptoms shouldn't be addressed. Um, and so I think, especially as it relates in healthcare, we as healthcare providers need to acknowledge that it is discrimination. That's something that we are doing to people, right? It's not a passive thing. We are doing it. And so that requires a really active response, and really sort of being super mindful of the ways that we're approaching people, the ways that we're treating people, because it does impact the likelihood that someone comes in. And then if we sort of fast forward to my work in the hospital setting, I see folks a lot of times where they have really severe infections. And my, not that I'm trying to ask it in a discriminatory way, but like kind of the thought in the back of my head is like, man, I wish you would come in sooner because now there are all these complications. And when we try to gently talk to folks about that, they're like, yeah, I tried. And I wasn't treated well, and I left, or I felt so discriminated against. I didn't want to come back until it got so bad I knew there was no other option. And so there are lots and lots of negative impacts from the discrimination that happens. And again, I'm like a healthcare provider, so I'm going to focus on healthcare, but from the discrimination that happens in the healthcare and treatment settings, and the ways that we treat people, the ways we engage with people. So anyway, that's just again something that I've still kind of been reflecting on since leaving this conference last week.
Yeah, thank you. And thank you for making that connection that it is a form of discrimination. Absolutely. I think that people don't think about it that way typically, because stigma is defined as how stigma is defined. But yeah, you brought up a really good point. It is discrimination. And what can communities do to reduce stigma and support people who are recovering from substance use?
Yeah, and I think community is such a broad term, right? And we all may sort of play a different role depending on our interactions with folks who use substances or folks with substance use disorders. And I think no matter who we are or what our interactions are, first and foremost, it's really important that we kind of step back and think about our own biases. And I always like to acknowledge, I think, I don't want to come across like saying like, oh, everybody's bad and we all need to do better. I think it's, I do think we can probably all do better, myself included. And I think it's also important to acknowledge that our viewpoints are this way because of literally decades of messages that we've all been getting, right? Both literally at every level, from the policy level and the laws we have related to substance use and, possession of substances, possession of paraphernalia, the criminalization of people who use drugs, down to sort of laws that employers have, to laws really sort of monitoring families that have ongoing substance use, and all of that, and not to mention media, like all of that influences the biases we all have. And sometimes we're aware of them, but a lot of times we're not. And that takes a lot of active work to really think about, oh, okay, why do I feel this way? Why am I experiencing this? For those of us who may have loved ones with substance use disorder, for those of us who may be in recovery, right, we sort of have our own lived experiences, and that very much influences the way we think about things. And it can be hard to realize that, like, I may be biased against someone else because that reminds me of an life experience I've had, right? Whether that be with a loved one or when I was in a bad place, and that can be hard. And so I think first and foremost, no matter who we are, no matter what our sort of, job is, or our interactions are with people who use substances, to really be aware of our own biases and to constantly be questioning our own assumptions about people who use substances, right? People's paths look really different ways. And so I think those are some of the first ones. And then if we are in a space in particular where we're working with people who use substances, so if we're a treatment provider or a peer support specialist or, a parole officer, like, to really be constantly thinking about, are the rules that are in place helping people or harming people? And I think a lot of times the assumption is, well, they must be helping. Why else would they be there? And the reality is, with our large criminal legal overlay in terms of how we've responded to substance use in this country, a lot of times they are just more based in discrimination and these sort of ideas that really haven't been played out by science, right? Ideas that addiction's a moral failing. We just need to penalize you and penalize you and penalize you until you change. Really, that's not what the science of addiction shows us. We really should be focusing more on supporting people, respecting people, giving them choices. So I would say, to the extent that we're able to constantly be questioning why we're doing the things we're doing and reevaluating, I think that's something that we can all do, kind of regardless of the space that we're in.
Yeah, I agree. Absolutely. I feel like this is really important to consider, looking at all these different perspectives, having the self-reflection and self-awareness needed to open up these conversations, open up these topics to, take a deeper look.
Yeah.
Is there anything else you'd like to add?
No, I would just like to say thank you for the opportunity, and I really appreciate that the sort of broad range of perspectives that you're gathering. I think it's easy to think about, this topic in a singular way, and the reality is that it impacts people differently. And again, like, the lens that we're looking through, all of us, is different based on our own experiences and sort of understanding. And so, yeah, really grateful to be here and grateful for the work that you all are doing.
Great, thank you. And we're happy to have you as well.
Thanks.
So thank you so much, Dr. Salisbury Afshar, for sharing your views on stigma, and thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a great day.